I'm Faye Watt, and let's queer up trans rights. Trump administration withdraws proposed anti-trans hospital rule after more than 30,000 public comments. The rule could have stripped hospitals of Medicare and Medicaid funding if they continued providing gender-affirming care to transgender minors. The proposal, introduced by the Department of Health and Human Services in December, never took effect. Its withdrawal follows more than 30,000 public comments opposing the measure, including nearly 20,000 submitted by supporters of the Human Rights Campaign. Major medical organizations also urged the administration to abandon the rule. Legal experts say the volume and substance of the comments likely expose legal vulnerabilities. Former Department of Health and Human Services General Counsel Sam Bagenstos says, quote, sometimes the comments come in and it's just overwhelmingly clear that the rule that they want to propose is indefensible, end quote. Human Rights Campaign President Kelley called the decision a victory for public advocacy. The rule would have allowed the federal government to remove hospitals from Medicare and Medicaid programs if they provided certain gender-affirming treatments to patients under 18, putting broader hospital funding at risk. The administration continues pursuing other policies targeting transgender healthcare, including a separate proposal that would restrict Medicaid and CHIP coverage for gender-affirming care for minors. Legal experts worry that this is a tactical retreat and not a broader shift in policy. So more than 30,000 public comments help stop this proposal. That's proof that speaking up still freaking matters. Yes. Democracy isn't just voting every 4 years, people. It's showing up every chance you get. Today, tomorrow, whatever, and today the people actually got to win.
I am such a cynic. When everybody's up there going, call your senator, write your congressman, all that stuff. And I'm always like, they don't care. It's not going to make a change. I'm so glad to sit here today and say I was absolutely wrong. In this case, it made a change. Right. Or it didn't make the change, as the case would be. Like you said, though, Faye, it's probably a tactical withdrawal, and they're probably going to come at it from a different angle, maybe a completely different department of the government. So we have to stay on our toes. But my God, I've never been so happy to be wrong in my life.
That never happens for you,
I mean, I think about the Medicare and Medicaid and the people that are on those, for especially gender-affirming care, and I would really want to quantify how many people that is, because I don't know really how many that would be. But at the same time, I'm looking at, do they not realize the damage that they're going to do by reversing and not allowing care to be given? I mean, both emotionally, physically. They're going to endure even probably more issues than what they're going through just trying to complete, get their care. Yeah. And I think that there's there's going to be a blowback because of it if that ever goes through.
Well, and stories like this, like vague stories like this, sometimes also hurt the whole situation, right? Because, people really do believe that we're doing, gender assignment surgery on 12-year-olds.
Right.
You know what I mean?
Right.
People really believe that.
Yes.
People think that we're doing them in schools.
Right.
In
prisons.
In the 8 hours that they're in school, we're doing something to them. You know what I mean? Right. So, with this, it's like, gender affirming care could be puberty blockers, could be therapy, could be sitting with someone that knows more than you and being able to get your thoughts across.
Right.
And with something like that, you wanted to cut funding for the whole entire hospital to help any transgender person.
Right.
Plus, gender affirming care, there's so many gender affirming care modalities for children that are not trans, right? So how is that legally and constitutionally correct, right? And as far as like public comments, it's so important for us to, in your local government, in your state government, to be abreast of what's happening and to make those public comments, because it does make a change. It does make a difference, as we see here.
Right.
So, yeah.
Yeah.
Do your thing.
So make those comments, okay? Be loud and proud, okay? When your significant other is like, are you on the phone? Yes, I am making my voice known.
And if you don't have the answer to make a comment, ask a friend.
Chat GPT.
Yeah. Well, that too. But
helps a lot. Just saying. There is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by sharing them and subscribing to Queer News Tonight.